It's pretty telling that most ADHD women get diagnosed once they're adults well into their 30s and 40s. There's little to no education about how symptoms tend to express themselves in young girls, and it's often when women are managing multiple responsibilities in adulthood that they realize that they're struggling to keep up. This delayed diagnosis means that they've spent crucial developmental years at a disadvantage compared to their peers, including those with diagnosed ADHD who received necessary supports and resources. The rusty gear gets the grease and all that. But what we're left with is a large amount of ADHD women who have been failed by our educational, healthcare, and mental wellness system, and are now left dealing with the academic, social, emotional, and economic repercussions. Hi, and welcome to my channel. Today we'll be discussing ADHD women and how you, as an up-and-coming counselor, can ensure that you're ethically and effectively helping your clients. Disclaimer: before we start, I want to acknowledge the importance of language and inclusivity when it comes to how we interact with these topics. In this video, I'll be using the term ADHD woman to refer to how ADHD tends to present in those assigned female at birth, that being a more internalized presentation. However, I want to clarify that I don't intend to exclude any transgender or gender non-conforming individuals who may also face the same issues. The reason I chose to focus on women was due to the disparities seen in how ADHD is diagnosed along perceived gendered lines, as well as how societal and cultural influences specifically affect ADHD women. It's important to keep an open mind and realize that, like most things, gender is a construct, and as we'll see, biological influences are only a small part of what contributes to issues like ADHD. I also want to clarify that I will be quite critical of the biomedical model when it comes to talking about mental health and counselling. As a student counsellor, I'm of the belief that many mental health issues we pathologize and medicate are just expressions of human emotions and accumulated distress in the context of an unsupportive and demanding society. By labeling people as disordered, not only are we robbing them of autonomy or authority over their self-perception and growth, but it can hide the underlying factors contributing to their struggles. However, as someone who is part of the ADHD community and discourse, I will also be using identity-first language, as in ADHD person, instead of person-first language, i.e. person with ADHD or person suffering from ADHD. This may seem contradictory to my earlier statement, but it's essential to understand why ADHD individuals prefer this terminology. Person-first language, while used in academic circles to emphasize that individuals are not defined by their disorder, can inadvertently separate the individual from their marginalized identity. This assumes that ADHD or any neurodivergence is inherently negative, leading to a desire to distance oneself from it. It also disregards how this marginalization and stigmatization affects the severity of an ADHD person's lived experience. In neurodivergent spaces, we recognize how our disorders shape our interactions and experiences with the world. Having ADHD is part of our self-perception, and many of us take pride in it. Therefore, it is reductive and unhelpful to view ADHD as entirely negative or positive. In this video essay, I'll be using the term ADHD woman to acknowledge and respect the preferences of the ADHD community. Finally, in this video essay, I will not be focusing on ADHD medication, as that is extraneous to a counselor's job. It is also important to recognize that not all ADHD people can be medicated. Due to the nature of stimulants, ADHD people with heart risks or chronic anxiety should avoid medication. For others, it can be a matter of the cost to access psychiatric help and prescription medication. Instead, I'll be discussing what ADHD is, why it's important to be aware of ADHD women's experiences, how to avoid falling into common counseling misconceptions and unsafe practices when working with ADHD clients, and ways to provide a safe environment for ADHD women. Part 1. What is ADHD? ADHD, also known as Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that affects a person's executive function, impulse control, attention, and retention. Symptoms usually emerge during childhood and tend to extend through to adulthood. In simple biomedical terms, the prefrontal cortex is responsible for managing and regulating higher brain functions like decision-making, emotions, thoughts, and behaviors. It communicates with the basal ganglia, which is associated with dopamine and noradrenaline. Dopamine is known as the reward center of the brain, while noradrenaline regulates attention, cognitive function, motivation, learning, and stress responses. In non-ADHD individuals, healthy noradrenaline levels help the brain stay motivated to complete tasks. Once a task is complete, the brain releases dopamine, releasing a sense of accomplishment and satisfaction. However, in ADHD people, this connection between the prefrontal cortex and the basal ganglia is unreliable and weak. As a result, they may experience mood swings, attention issues, poor executive function, memory problems, impulse control difficulties, low motivation, and an increased likelihood of anxiety disorder and depression. This can result in 3 classification types of ADHD: hyperactive impulse type, inattentive type, and combined type. Unlike 15 years ago when ADHD was often associated with hyperactive, impulsive boys, today awareness initiatives, social media, research progress, and internet accessibility has reduced stigma and led to a more comprehensive understanding of ADHD. The use of the biomedical explanation of ADHD and the growing acceptance towards the use of medication has helped combat the the misconceptions of ADHD being an active choice and the fault of the individual. That's not to say that there are not negative feelings towards those with ADHD. Many people with ADHD have recounted the negative perceptions they've encountered from family, friends, teachers, and wider society. Misconceptions about ADHD lead to differential treatment by teachers, resulting in lower evaluations of academic function despite comparable performance to non-ADHD peers. And healthcare practitioners may negatively view ADHD individuals based on these misconceptions, seeing them as antisocial, a result of bad parenting, or weak-minded. These negative perceptions create discomfort for adults seeking a diagnosis to improve their quality of life as they fear potential social consequences. Despite the concerns of overdiagnosis, ADHD rates may continue to rise due to the societal individualism and increasing pressures on individuals to maintain high executive function skills, something ADHD people tend to struggle with. Humans naturally exist all over the bell curve when it comes to individual skills. Unfortunately, what we're seeing is that the skills ADHD people excel at, creativity, divergent thinking, emotional intelligence, and sublimation, are viewed as less desirable. This is where we begin to see the way society and culture contributes to ADHD severity. Collectivist support systems have been continually deconstructed by Western governments who outsource welfare to NGOs or private businesses. Not only are people feeling more isolated and lonely, but collectivist movements are actively frowned upon for disrupting the status quo. I won't start ranting about late-stage capitalism, but a society of isolated individuals makes for easy exploitation. And the capitalist tendency to attach moral goodness to productivity makes it easy to assign blame and label those who struggle with function on the day-to-day as disordered. Without recognizing the psychosocial influences that contribute to ADHD, we effectively stunt our ability to understand and approach ADHD holistically. We also limit how effective we can be as counselors. If ADHD could be cured with a pill, then why would counselors even need to be part of this discussion? So let's put a pin in that. Part 2. Women and ADHD. While biologically, ADHD across all genders looks fairly similar, the way symptoms express themselves is usually a result of psychosocial influences and experiences faced by women and men. Unfortunately, because a majority of underpinning ADHD research has been done on males, the way that ADHD symptoms express in women has been overlooked and under-researched. The research that does exist has shown that women tend to internalize their symptoms, a reason cited for why so many ADHD girls fall through the cracks during schooling years, and also why they're more likely to be diagnosed as the inattentive or combined type of ADHD. These symptoms can include low self-esteem and chronic feelings of inadequacy, difficulty in maintaining or establishing relationships with peers due to being perceived as thoughtless, higher likelihood of comorbidities and anxiety, depression, other emotional and personality disorders, masking, a coping strategy where the individual will adopt behaviors or habits to hide symptoms. Examples include stimming, developing perfectionistic tendencies, hiding true emotions beneath more socially acceptable ones, and mimicking or mirroring those around you to be accepted. Fluctuating severity of symptoms depending on menstrual hormones. Rejection sensitivity, like intense reactions and sensitivity to perceived rejection or criticisms. Currently, these symptoms are not included in the DSM-5 and thus resulting in women being 3 times less likely to be diagnosed with ADHD despite struggling just as much as their male counterparts, and ADHD occurring equally among the sexes, effectively locking many women out from being able to access resources and support systems they need to not only just survive each day but thrive. It starts to make sense now why we are seeing ADHD women developing additional psychiatric disorders at a higher rate than both their male counterparts and those without ADHD. In fact, recent psychological discourse has begun connecting a considerable portion of cases of mental ill health, such as anxiety, depression, mood or personality disorders, substance abuse, and eating disorders, to undiagnosed ADHD. The cultural box that most Western women have been exposed to their whole lives demands that for a woman to be deemed acceptable and desired, she must fit the gendered role assigned to her. Women are expected to do the majority of the executive tasks in daily life and are socially punished harder for failing to meet those standards. ADHD women can experience being labeled ditzy, thoughtless, lazy, and irresponsible, adding to the self-perception of inadequacy, and also diminishes the struggles ADHD women face as frivolous and superficial. Many diagnosed and undiagnosed ADHD women develop perfectionistic tendencies to compensate for and mask their perceived shortcomings and insecurities, putting them at a high risk of developing eating disorders or disordered eating patterns like extreme binging or fasting without necessarily fully developing an eating disorder, which makes it all the more concerning that many ADHD medications, due to the nature of being stimulants, have the side effect of suppressing appetite. Despite recent feminist pushes for equity of responsibilities in the home, there is still a large disparity between men's self-perceived contributions and their partners, with less than half of women expressing satisfaction with the fairness of housework distribution between their partner. Now, when you factor in that many ADHD people gravitate towards other ADHD people due to similarities, and that ADHD is hereditary, women feel that they're not only responsible for their own ADHD, but also the ADHD of their families, placing more undue burden on ADHD women. Women on average also earn less than men, but pay more for necessities, and the current political and economic climate has placed a lot of emotional burden on women, seen in the removal of rights to bodily autonomy, increasing demand for unpaid emotional and support labor, increased responsibilities in and outside of the home, economic instability, and single motherhood. Coupling this with ADHD women finding that their ADHD affects their academic and occupational performance and limits their ability to achieve their economic potential means that many ADHD women in vulnerable positions are unable to afford or access psychiatric help or medication. Undiagnosed ADHD profoundly impacts every aspect of life. Without acknowledgement, validation, recognition, or proper support, many women continue to struggle daily, stressed out by their own behaviors and feelings, doubting their self-efficacy, value, or worthiness of help, when usually being open about our struggles is met with accusations of self-victimization, softness, or laziness. Understanding how these influences affect ADHD women is crucial for future counselors to provide tailored support and advocate for their well-being. Part 3. Counselling and ADHD. Remember that pin from before? So why do you need to care about ADHD women specifically when the research shows that despite limited understanding of the risks and benefits, ADHD medication is our current best form of symptom reduction and improved quality of life? Let's make a quick rundown of what we've talked about so far. ADHD women are less likely to be identified as having ADHD at a younger age due to limited understanding and research into how ADHD presents in girls. This also means they're less likely to access medication or other accessibilities, resources, and support systems. This means they're more likely than their male ADHD and non-ADHD peers to adopt maladaptive coping skills and are at a higher risk of developing comorbidities. This remains true even when ADHD women are diagnosed. And for some ADHD women, medication is not an option either due to the cost, ineffectiveness, or for health reasons. The disadvantages faced by ADHD women in this current context isn't completely solvable by medication. And as a future counsellor, it's crucial to recognize the significance of understanding the challenges faced by ADHD women and the psychosocial factors contributing to the severity of the disorder. Not only will you most likely work with diagnosed and undiagnosed ADHD women as clients, but you very likely have encountered many already. As a counsellor, you might not be able to prescribe medication, but you are able to use your knowledge, skills, and resources to holistically approach and support mental health wellness for ADHD women. Being aware and educated about these issues is essential for promoting ethical and safe practice with marginalized groups. Now let's have a look at some of the most common misconceptions and unsafe practices well-intentioned counselors may engage with when working with ADHD women, as well as how to keep yourself accountable and to avoid these issues. To clarify, there is surprisingly limited academic discourse or literacy in this topic, more so when specifically looking at ADHD women. So I'll be basing this portion on ADHD specialist board-verified articles, as well as my own experience of ADHD diagnosis and counseling as a femme ADHD person. Believing that your profession/expertise makes you immune to bias. As we've discussed, unchecked biases about gender stereotypes and assumptions about ADHD based on limited research leads to misdiagnosis or underdiagnosis in girls and women. Additionally, unchecked biases can lead to counselors using overgeneralized, ineffective, or insensitive approaches that do not address the unique challenges faced by ADHD women. This may also contribute to a breakdown of the therapeutic alliance, hindering the therapeutic process and reducing the likelihood of positive outcomes. By continuing your education, engaging with the current ADHD academic literacy and social discourse, working with a supervisor to acknowledge and address biases, becoming more familiar with multimodal treatment approaches that have shown to effectively help ADHD women, i.e. mindfulness, narrative therapy, and positive psychology, counselors can create a more inclusive, supportive, and safe environment, ensuring that ADHD women receive the tailored and effective care they deserve. Believing that your client just needs more discipline or to try harder. Despite the fact that this is just fundamentally wrong, non-ADHD counselors have engaged with the rhetoric that positions ADHD as something you can just muscle through without any consideration for the emotional toll that would take on someone. While discipline is a necessary skill, it is still a skill, and many ADHD women already recognize that they struggle with discipline. So while it might not be your intention, this can come across as infantilizing, patronizing, and feed into feelings of shame and low self-esteem. ADHD women can experience intense emotional distress when they perceive being rejected, judged, or criticized, and tend to avoid re-entering those situations. As a counselor, it's your duty of care to your client to ensure a strong therapeutic bond. Adopt unconditional acceptance towards your client. Remember that they are the expert on their life, story, and self-perception. Avoid making assumptions that you know what's best for your ADHD client, and be a guiding force on their journey of self-actualization, believing that medication will fix ADHD. I hope that by now I've made it fairly clear that it's reductive to believe that medication can cure a complicated issue like ADHD. ADHD medication is not a panacea. It does help with lessening the severity of symptoms and their day-to-day impact, but it can also exacerbate other issues like suppressing appetite, heart problems, and anxiety. Most ADHD adults will be prescribed ADHD medication without being made aware of their other options when it comes to treating ADHD. As a counselor, it is crucial to recognize the psychosocial influences of ADHD, such as the impact on self-esteem, relationships, day-to-day function, and the development of maladaptive coping strategies. Implementing psychoeducation, counseling techniques, and supporting the development of sublimation and healthy coping skills can complement medication and provide a more comprehensive and personalized approach to managing ADHD. Emphasizing the importance of a multimodal treatment plan can empower clients to explore various strategies to improve their well-being and navigate the challenges associated with ADHD, believing that ADHD women are a monolith. Assuming that all ADHD women will respond the same way to treatment or counseling interventions can lead to ineffective and insensitive approaches, and overlooks the unique experiences and needs of each person. As a counselor, you need to remember that while you have trained, researched, and studied, you will likely never be able to fully conceptualize every individual's experience. To avoid this mistake, counselors should adopt a person-centered approach, recognizing that each client's experiences, strengths, and challenges are distinct. Taking the time to listen actively, validate their experiences, and collaborate with your clients to understand their specific struggles and goals can help counselors tailor their interventions effectively. Emphasizing the individual experience and avoiding generalizations about ADHD can promote a more empathetic and inclusive therapeutic environment, leading to better outcomes for your ADHD clients. Additionally, staying up to date with the latest research and attending ADHD women-specific training can further enhance a counselor's understanding of the complexities of this condition and its diverse manifestations. Part 4. Conclusions. In conclusion, ADHD women face unique challenges that have often been overlooked or misunderstood in the past. Many are diagnosed later in life, leading to missed opportunities for support and development. As future counselors, it is essential to be aware of these issues and be equipped to provide effective and ethical support. By understanding the psychosocial factors contributing to ADHD in women and avoiding common misconceptions and biases, counselors can create a safe and inclusive environment for their clients. Medication may be helpful for some, but it's not a cure-all, and a multimodal approach, including psychoeducation and counseling techniques, is essential for comprehensive and personalized care. Emphasizing individuality and avoiding generalizations can lead to better outcomes and help ADHD women flourish in their lives. As we move forward, let's work together to promote understanding, support, and empowerment for ADHD women and individuals of all backgrounds. I hope you enjoyed this video. Make sure to like and subscribe and comment below if you had any thoughts or questions. I look forward to seeing you again. Bye bye.